eye, and sometimes that can impact our vision and our eyes. And unless we have an allergy attack or our contacts aren't putting objects in focus anymore, many of us take our vision for granted. May is Healthy Vision Month. It's a good time for a checkup. Dr. Margaret Chang is here with advice for keeping your eyes healthy at every stage of life. Good morning, Dr. Chang. Thanks for being with us.
Thanks for having me.
We have bad allergies here in the Sacramento region, and I'm always wondering how that allergies is affecting not just my vision, but as well as my young ones, because we're always scratching our eyes.
Yeah, well, allergies are a huge problem here in Sacramento. So definitely using artificial tears and things like that are going to be helpful for allergies, antihistamines. But, these things that bother the outside of the eyes are actually not as scary as some of the things that can bother the inside of the eyes, like diabetes in the eye or wet macular degeneration. Those are some of the things that I focus on as a retina specialist. And that's what I like to look at for Healthy Vision Month. Diabetes is a problem that can affect the back part of the eye and cause bleeding in the back part of the eye. And we don't even have those symptoms. So people wouldn't even know about it unless they get a checkup with their eye doctor.
You just mentioned diabetes can affect vision and eye health. What are some of the more common eye diseases that we can get, and what are the risk factors? What are the signs and the symptoms, and when should we know we have to go see a doctor?
So problems focusing can sometimes be a cataract, but sometimes that can be a sign of diabetes in the eye, or it can be a sign of macular degeneration. So getting an eye checkup with your doctor is going to be very important for them to figure out what it is.
A lot of us may not even be experiencing vision issues. So how do we know how often we need to see our ophthalmologist?
So we usually need to go in at least at the age of 40 for a screening checkup. But if you have a history of diabetes or a family history of eye disease, then you do need to get checked sooner. And then diabetics need to get checked every single year to make sure there isn't anything that needs to get treated sooner.
Okay, some people get the heebie-jeebies when they think about going to the eye doctor, right? So there's some new and advanced technology that might ease some people's fears about going to see the eye doctor.
So absolutely, in terms of the new things that we've got for what I do, we've got some newer things. Instead of injections every single month, there's now going to possibly be a surgical implant for wet macular degeneration where people don't need to have injections, so they can get refills every 6 months instead of an injection. Or they can get injections less frequently, so maybe up to 4 months between injections instead of every single month. So it's pretty cool.
All right, Dr. Chang with Healthy Vision Month, keeping our eyes healthy, also looking out for the signs of disease. Thank you so much for being with us this morning.
Thank you. I appreciate it.